Okay. Bismillahirrahmanirrahim. We are about to start our third Google Hangout session, the first for this year, 2015. And I'm pleased to have Arsalan and Osama with me and Noman Akbar as a coordinator. There is going on a little bit technical difficulties, but it's a part of it. So the main purpose of this hangout is not a new thing. It's every year we do. The first hangout of a year is all about the preparation schemes of step 1, step 2, 3 NCS, and the second part is about the interview preparations, how to make errors, and all that paperwork. So everything is on the forum. We will talk about whatever has been posted on the forum. But the purpose of this live communication is to encourage you guys to come up here and ask the question whatever you want to, so that we may give you the best possible answer from all those people who have gone through this process and they are now at a successful place. So we will talk about briefly about the first part of this hangout will be about the initiators who have just started about step 1, step 2, step 3, how they can have the maximum scores and what is the maximum score. And then we will talk about CS and the strategies of CS and what is the impact of CS on your MLE outcome. Third portion will be about the USCE. That's a part and parcel of the MLE preparation. It's also called step 4. So USCE will be about how you can, where you should go and what kind of LORs you should write. So Salan will talk about that. And in the last, we will talk about doing a step exam while you're in MBBS before graduation, because many people asked me a question on the Facebook that how this is possible. So we will tell how this is possible. So starting from step 1, preparation scheme, I will just briefly elaborate step 1, step 2. Both these exams, I have said before as well, there's a rule of half for the duration wise. For step 1, it's 8 months. If you half it, for step 2, it's 4 months. If you half it, step 3 is 2 months. And if you half it, CS is about 1 month. So this is the general duration scheme. When you read 8 to 10 hours a day, you should be finishing step 1 before 8 months. Ideal time to
Sorry,
start.
Waqas bhai, we cannot see your video. So if you can press on the video tab on the top of your screen.
Now better?
There is a tab up there, ऊपर है करके, जहाँ पे लीव कॉल है, सेटिंग्स है, वहाँ पे एक टैब है वीडियो का बना हुआ. It says turn camera on or off. So if you go there, you can.
Camera is on now.
Okay, we cannot see.
हम लोगों को नजर आ रही है.
नीचे क्लिक कर लें आप अपने नेम पे क्लिक करें, जो नीचे सारे बंदों में से अपने आप को क्लिक करें.
Actually, some of the guys are saying that they can see the video, so we can
नजर आ रही
continue talking. Yeah. So let's continue.
Okay. So step 1, the best time to start step 1 should be March. Not it can be before March, but it should not be beyond March. Because why? The whole circle, if you start around March, the whole process finishes around August next year, and that's the time you apply the ERAS CV, September next year. So you should keep this month of March and April very important. If by some reason you have delayed it to May, it doesn't mean that you can't do it, but you have to be a little unconventional, out of the way. You have to be a little more hardworking. So all scheme has been uploaded on the forum very clearly, month-wise, week-wise, day-wise. I'm not gonna go there. It's a law. Everyone can see. People are telling us that this scheme is helping them. So I'm just not gonna touch that part. But I'm just pointing out one thing. There are 4 reads in step 1, and each read adds on a thing. Like when you do first read, you just read the Kaplons. When you do the second read, you add on one thing, and that is your first read. When you do the third read, you add on another thing, that is Kaplan plus first aid plus UWorld. And when you do the fourth read, you do Kaplan plus UWorld, first aid, and the video, some add-ons. Some people add some Golden, so some add-ons. So my point is that each read is meant to add something. It's not just reading the previous thing you have read before. And then you do, after 4 reads, you are supposed to take a sample exam, that is the NBME sample exam, and if you score 250, mark this number. Don't take your step 1 until you get 250, 254. Don't take the exam. In our days, we were told about 230, but now numbers have changed. You must have seen that post on the forum about all the percentages, and so you must have noticed maximum people who have matched, they have numbers above 250. So now you should keep this figure. If you by some chance you're not getting 250, 255 in your NBME, just relax, calm down, consult a senior, and delay your do another preparation by like 1 or 2 weeks. Or some people do 1 month and then take the NBME again. So if the NBME you get 255, then go ahead in 6, 7 days, 10 days, take the exam. So this is a very brief summary of step 1. Important thing about that, step 1, sometimes you cannot maintain everyday study 8 hours a day. Not a problem, that's a normal thing. But at least don't make even a single day where you don't touch your green books. Even you touch them for 1 hour, that's enough. But at least touch them every day. That's the main problem. Because if you don't read for 2-3 days and then you again start, you just remove that part before, like there is no rehearsal, there is no reconciliation in your mind. So these things about step 1, just very briefly. I will briefly explain step 2 and then I will back to Osama for CS. So step 2 is exactly the same thing as step 1, but it's a lesser number of months. You need to work on just on 4 months, not more than that, and you will be good by that. Step 2 is also a 4-read process. Some people have done during 3 reads, but that is a personal thing. Some people, but conventionally I would say 4 reads again. Books are the same and strategy is the same. You do first read, Kaplan, and then in a second read you add on. And you add on NBME, Master the Board. Master the Board has the same role in step 2 as first aid has a role in step 1. And after Master the Board, then third read you add on your U-word. And then in the fourth read, you just review the videos, some small add-ons. I would mention specifically one thing here. While doing step 2, reserve 4-5 days for yourself to do the Master the Board of step 3. People have reported us that people who have read Master the Board step 3 for step 2 exam, they score 10 points, like more. 5-10 questions they get correct, which though other people do not get correct. So, and it takes just 3 or 4 days. Last thing, drug ads. Drug ads is a part, like they ask you 3-4 drug ads and people really don't know about what is this, because we have never practiced those things. Practice drug ads before you take step 2. There is a online, you can just check from the online link. Many links have been shared. So do drug ads. And last thing, there's a biostat part. $25 link, they sell a link of $25 that is for biostat. If you just do that link, which takes just 6 hours, your biostat part is complete. That is related to your all behavioral science questions related in step 2. Another thing which people do not know, the importance of pictures. There is a link called DermNet. DermNet, DERMNET. DermNet is a online atlas for all the diseases which have skin representations. All rheumatological diseases, infectious diseases, which have some skin representation, skin symptom signs, they are over there. If you just do that DermNet, that takes just 6 hours. You can, just by seeing that picture on the MLE exam, you don't need to go in deep into the question, you find out the answer. And again for step 2, take an NBME. If your NBME score is 254, 255, go ahead, take the exam. If it is not, just calm down, consult your senior, do 1 more month, and then come back again. There is no option where you can score less than 230 these days. Just keep this thing in mind. I'm not saying that some people have taken me wrong on the forum when I mentioned about the scores. My point is not to discourage anyone, but we cannot give you the false assurance. That is also wrong. If I tell you, oh man, you are 220, you will be fine. That is wrong. I'm not saying you cannot have the residency, but I'm saying you have to do something extra. And if you go to that file, USMLogram. You have seen those extra things which I mentioned over there. If you are 220, 230, what extra thing you have to do to make you equal to 250? America is all about scores. There is nothing, other things they just add on. If you have good scores and you don't have other things, you will be fine. So just keep this mind. Don't pick our words. We just try to be fair to you, and we don't falsely reassure the people. Because if we falsely reassure everyone, then they will stop working anything extra, and they will be at like loss. So this is the just summary of step 1 and step 2. 8 months, 4 months, try a number like 255, 250, and just keep in your mind while taking the exam, whatever you're gonna do today is gonna fixed. It's gonna frozen. There is no other way you can come back and improve it again. So just that is the most scary thing about these 3 exams. CS step 1, step 2, step 3, that you cannot improve them. USCE, you can always improve them. So from here I will stop. We can take all answers, questions like in the end after we've finished presentations, so that if you have any question regarding my this thing, you can ask in the end, I guess. Now I will switch over to Osama.
Thank you so much, Waqas bhai. About step 2 CS, all I can say is that this exam, although it is small, it is really important. Waqas bhai, can you please mute your
Yeah,
phone?
just a minute.
Thank you. Yes, okay, perfect. So I hope you can hear me now. So yeah, like this exam, like although like it's really, we think that it's easy and it's small, but this is the most important exam. Trust me with that, because even if you get a really low score in step 1 and step 2 CK, you can compensate that. But if you fail or flunk this exam, you are screwed. Trust me, you are screwed, and it's gonna be really tough to come back. And it's also a career-changing option for most of the people who are pursuing the career in US. They have to like literally stop pursuing it because it's such an important exam. So first of all, take it seriously. Don't take it lightly. Don't think that you can do it in 20 days or like 2 weeks, and or like if you are not satisfied, don't go for it. You take this exam only when you're 100% sure. So that is really important. And also like where to prepare this exam and what to do. I would say that find a place where most of people are preparing for this exam. Like in our time, there we used to go to Detroit, and like everyone is preparing for CS exams there, and we get to use all the guidance from the seniors and everyone. And also, uh, excuse me 1 second. Fatma, can you please mute your computer? Fatma, hello. Okay, hold on. So, now people are going to Chicago, and they can like go there and prepare for the exam there, and that's a very good option. Find a place where people are preparing for the exam, and then like find a study partner. You need a partner with whom you can prepare with this exam and everything. All right, and then like after like you are done with this preparation, you need to show it to someone like who has already given the exam. And okay, is it fine now? One guy.
I think there is a lot of distortion in the phone. Maybe
Is it
let's see if everyone. Osama, can you mute your microphone?
okay?
Everyone except the
Hold
speaker should mute a microphone. Hello, Osama,
Did
can
it
you
make
hear
any
me?
difference? Yeah, did it make any difference?
Uh, no, not much. I think. Can you try something different with your microphone or something like?
I think I can hear you really well. Other than everyone else, can they hear me?
No, Osama, I think the distortion is from your line, because when you mute, everything becomes fine. So maybe something in your headphone, or if you can
Okay,
try,
let me disconnect.
that would can also make a difference.
Yeah, it's fine now. It's fine, Osama. Go ahead. Osama, we cannot hear you.
Somehow we cannot hear.
Osama, we cannot hear you.
You hear me now? Hello?
Yeah, we can hear you. We can hear you.
Okay, all right. So as I was saying, that go to a place which is IMG friendly. Like most oftenly it is Chicago or Houston, because there the all the SPs are already acclimatized to you and your the way you speak. So it's really good you go there. And also, yes, I have an advice for the people who go there, who go to US for electives during their final year or like just after their graduation, that do take their step 2 CS while they are there, because later on, because of its like reporting schedules and the results, it gets really tough to get done with it, and it often costs them an extra year of match because of the step 2 CS results. So if you people are going to US for your electives, or like just to get USCE, you gave your exam at that time. It might take 40 days, 50 days, but lots of people have done it, and you can do it too. I think that's all for CS. If is there anything you would like to add, or you would like to ask questions, you can do it. I would like to now hand over to Muhammad Aslan Beg for USC. I hope. Can you hear me, Aslan?
Yes, sure, I can. Assalamu alaikum,
Oh,
everybody.
sure.
Can you hear me fine?
Perfect.
Yeah. Yes.
Okay. My name is first of all, introduction. My name is Muhammad Arslan Beg. I'm a graduate of King Edward Medical University of session 2012, and I just married this year in Cook County Hospital in Chicago. And I would basically like to talk about some of the things which are least understood among most of the people who pursue USMLE pathway. We should understand the thing that surely, as Waqas Bhai told, that USMLE scores are one of the most important factor in getting matched in the US system. But the thing is, you have to understand it in the fact that with your scores, you are just making a CV. You have to add other stuff to your CV as well, and then you should know where to apply with that CV, how to pursue those programs, and when they invite you for the interview, how you should give interview to those programs, how you should coordinate with those programs after the interview. So the thing is, what I think is that your scores basically comprise about 50% of the USMLE preparation. Most of the people you would have heard that who had like amazing scores like 240s and 250s and did not marry this year. The main important fact, the main important reason for that was a lack of USCE, or they became slack after getting good scores in the USMLE, and they did not work on their ERAS application, on their medical school performance evaluation, on their on their LORs, on the programs where to apply, and how to coordinate with those programs. So as Waqas Bhai and Osama have spoken about USMLE Step 1, Step 2, and CS, and there is a lot of guidance available on the forum about that. So I would like to talk about a little bit all this stuff which is basically required after the USMLE exam, especially for the people who are going to apply this year. So the thing is, I want to make a list over here. As June is approaching, after 2 days, so what you have to do is that you have to start working, especially those people who are applying this season. You have to start working on your step 3 if you have not taken it yet. Because my experience is, because I had average or above average scores, but I had like 29 interviews last year. And the main reason was because I had a really good score in step 3, which was 239. So if you have not taken your step 3 exam, and especially if you're looking for a community program with an H-1B visa, must take your step 3 exam before September 15th, and get the result before that. Second thing is, you have to get 4 waived US LORs, and it is advisable that all of them should be from American people, if not all. The benefit of 4 waived LORs is actually that I applied in one of the hospitals. Basically, I got interviewed from there, and they told I was probably one of the very few people who got interviewed from the program in New York State, because of the fact that that program requires 4 waived LORs. So my point is, when you go for your clinical electives or you go for your observerships, you should always look for working with American people, and you should get waived LORs in the end. The other thing is, a lot of people ask, about the USCE, that either university programs are better or residency programs are better. So the thing is, everything is important. Even if you are working in Pakistan, any hospital, as medical officer, as anything, everything is important. But the thing is, there is always a priority. The most important things, the most important thing is the best thing is basically working in the university hospital in the US. Then there can be, a residency hospital, which is a community hospital. Then there can be an inpatient experience in a hospital in the US which does not have a residency. Then you can work in a private clinic in the US. Even you can work in like Canada, you can work in Ireland, wherever, that's going to work as well. But the thing is, there is a priority. Even if you work in Pakistan and get an LOR from there, that also works. But the thing is, that would be the last resort. So the best thing is, the ideal thing is to get 4 LORs from US, and it's better that all of them should be waived. The other thing you have to start working from June is your personal statement. I would really advise you people to start working on it as soon as possible. Start gathering points on what you have to write on them. There can be a separate Google Hangout session for like 2-3 hours only on the personal statement. So I'm not going to talk about it that much longer. But the thing is, there are like five to six questions, as Vikas Bhai has already mentioned in the forum, which are supposed to be answered. That, why did you join your medical school? Why did you become a doctor? Why are you going to internal medicine? Why do you want to come to US? And what benefit are you going to give to the program if they recruit you? Things like that. So start gathering the points. Start gathering points about your childhood and things like that. Funny things you're going to discuss, and start writing in paragraphs, and then keep reviewing them for the next 2 or 3 months until you get a nice one by the end of the month of the August. So 4 waived LORs, step 3 exam, and your personal statement. Then there is another thing which is called the ERAS CV, and you also have to start working on it at least from the starting of the July. Make a good one. There are samples available on the USMLE forums, so you can consult them. Then the other thing is, from the starting of the September, you should start looking for the programs you're going to apply in. Then you should start contacting the program. So probably we're going to have a separate Hangout session about that as well. So my point is, your scores, they constitute about 50% of the probability of your matching into the US system. The other 50% is about like 5 to 10% goes to personal statement, 10% goes to ERAS CV, then 5 to 10% goes to how do you contact the programs, which programs you apply to, how do you, I think 25 to 30% goes to at least your interview skills. A lot of people who get like 20-25 interviews with excellent scores match in their 10th number program or 15th number program because they do not have good communication skills and things like that. So you have to know how to interview in US as well. And then you have to know, how to coordinate with the programs after on. So all these things add up, and they increase the probability of your matching with the US system. So even if you have like low scores, like 220s, 210s, or whatever, these are the things you have to work on. You have to improve your CV, improve your personal statement, add some research, cherries on top, apply to nice programs, coordinate with them, and that's how you can increase your probability. Even if you have like excellent scores, 260s, 270s, or whatever, even then, if you would not work on these things, like your personal statement, CV, and nice coordination of the programs, I can guide on this thing separately, but it's going to take a lot of time. So with the passage of time, you should at least have in your mind what things you have to work on. Ideally, the people who are applying this year match, they should have their step 1, step 2, and CS score by now, and they should be working on their step 2 right now. And meanwhile, they should be working on their personal statement, their ERAS CV. The people who are in Pakistan, they should go to your medical school and get a nice customized MSPE. You should also get a letter of recommendation from the chairman of the medicine of your university where you graduated from, because some programs also need that. And then from the ending of the August, you should start looking for the program where you should apply according to your credentials. Then in the starting of the September, you should start communicating with those programs. So that's how you should steer your pathway towards the USMLE. And about the USC, I would say grab anything you get, fill any kind of gaps you have in your CV, and I think you should be good to go. And if you would have any questions, just let me know, and I'll be here for you guys. Thank you so much. Over to you, Vikas bhai.
Okay, so thank you very much, Arsalan. So Arsalan mentioned about very important point, that is actually personal statement. Many people really do know about it, So of course we have a separate session that would be August, as we have every year 2 sessions. So our second part will be more about ERA's CV, how to write a personal statement, what program list we should go for, and how we should take interviews. So this is all, but definitely we will talk about it. So by this time we have spoken about step 1, step 2. We have talked about USC, as Arsalan mentioned, that he brought up a very good point. There is nothing like a residency hospital or a community hospital. All is a hospital, first of all. You should have if you were given an option for a clinic versus a hospital, go for the hospital. That is first point. Among the hospital, if you are given option a community hospital versus a residency hospital, of course everyone would go for residency hospital. But my point is that clinic experience is also good, but just it's like something better than nothing. But if you have an option of a community hospital, you should go for that, because in community hospital you have a hospital settings, inpatient settings. Number 2, most of the people must be knowing that we started a cartridge rotating system this year. I'm happy that last year we helped from 25 to 30 people, and this year it was more systematic, and it was more like block wise. We made blocks, and in each block we accommodate 5 to 6 persons, 4 boys, 2 girls, and then we shuffle. We always don't feel bad when we don't respond to your email. Don't think that we have not read it. We always keep in our waiting list, but we have to prioritize. Now ask me how and why we have to prioritize. First of all, I have to look at MLE scores. If you have an MLE score of 275, like someone applying 275 to 70, and he asks me a 3-week rotation in Karthik, I would say, man, you do not need it if you have had previous US experience. In comparison to that person, a person who has a score of 245, 250, he has no United States clinical experience. He asked me the same question. Whether he has asked later, it's not a first come first serve basis. It's not a sale. It's not a bargaining thing. It's all we decide that who is the person who will be benefited most. Okay, let's talk about a third category. Some person, they have scored 220 to 10. They have 9-month United States clinical experience, and they ask me, Dr. Nawaz, we need 3-week rotation and our score is that. So I think they are also not that person, because if 9 months has not helped them, do you think a 3-week rotation will help them? It will be a waste. It will be a waste for those people who is in the middle category, who can be benefited most. So that is the thing we look when we choose the person to send over there. And there's always a waiting list. For each block, we have 4 or 5 person in the waiting list. When someone cannot come due to certain reasons, we tell the next person. But don't feel bad just because that we have not responded or you are not being selected. Just think that if you're not being selected, either you do not qualify for it or you are in the waiting list. And many people have benefited from the cartridge rotation. Osama went there, Noman went there, Arsalan went there. I spent a lot of time over there. It's a very small hospital, but it has helped many people, because the mentor over there, he is very dedicated. He really teaches you not the academic stuff, but he also teaches you how to live in the United States, and that helps. That goes a long way with you when you do your residency and stuff. So that's the only thing I wanted to mention about cartridge system, because people think that we do not respond sometimes in time. You do not qualify for it, or you are in the waiting. And many people have benefited from the cartridge rotation. Osama went there, Noman went there. Yeah. So just think like that. We are in residency. You have no idea how tough are the working hours. You wake up like 7. You are work at like till 9 o'clock. You are doing rotation. You are doing some observership. You are in the ICU, and you have to respond to the emails. So this is very tough. It doesn't look good when you're rounding with your attending and you have to respond each and every email. So that's why there gets a delay when we have to respond. But I hope you guys will understand, especially when you get into the residency. Hope so. So okay, so that was about USCE. Let me briefly tell about LORs. There was a hospital in New York Many people know about that hospital. It was an outpatient service. Jewish hospital. Okay, someone's mic is on. Okay, Kingsbrook Jewish Hospital. So that hospital actually lost the importance of the LOR because of a lot of LORs which exactly look the same. Please be very mindful that you cannot just replace Muhammad Arsalan with Muhammad Usama and the rest of the body of the LOR is the same. This is not the way it is. You have to be really customized. You have to really personalize your LORs. Your LORs, when the mentor attend program director, they see your LORs, they very quickly find out that it's a copy paste because your colleague has applied the same hospital list you have applied. We all know that we applied those particular 100 hospitals. Everyone applies those. So when the same LOR goes there and they say that Mr. A is very good in diabetes, electrolytes, and very good in the algorithm. Mr. B is very good in algorithm. Mr. C is very good in algorithm. So they pick up that this is a copy paste. So just do not do it. Just select one good. Ask your mentor who you have worked with and ask him that write a good one personal sentence about my clinical acumen. When you write a letter, don't forget those 6 competencies of ACGME, American Council of Graduate Medical Education. They ask for 6 competencies that include your medical knowledge, your professionalism, your system-based learning, your practice, learning-based practice, and then there is one more, I think, professionalism or medical knowledge. So you have to just keep those 5-6 competencies in your mind while writing an LOR. Like you are, how much professional you are, how much in time you used to be, how well dressed you used to be, what kind of medical knowledge you own, and what is your diagnostic approach, and how you apply your medical knowledge. That is also the same, equally important. So these are the things you should really mention in your LORs. I get a lot of CVs, and I request again from this forum, when you apply for rotation, when you send email your CV to us, just do not write all those big things which you have done. I know you are all very good, but you are not applying a program residency. You are just applying for a 3-week rotation. For that, you just need to send me 4 things. You need to send me your step 1, step 2, step 3 scores. You need to send me your graduation and the medical college name. You need to send me previous United States clinical experience if you have had any. And you need to send me the name of the months where you are comfortable rotating, like 2 or 3 month period. That's it. I do not need that all those research which you have done at Mayo Hospital or in the Cleveland Clinic. That's very good. But it becomes very tough for us to go through all CVs. I went through 175 CVs. Would you believe that? So it becomes very tough when everyone is looks like that everyone is a scholar. So just briefly send me, and so that we can quickly screen. So that's how it is. So okay, so we talk about LORs, and in the last we were thinking to talk about doing USMLE in MBBS as well. That is, many people ask us the question that how we can do MLE when we are not graduate. First of all, this is a very good concept. When we used to be the undergraduates, no one told these things. We used to think that MLE is something you can do only after your graduation. But trend has shifted. People are more aware. People have more awareness by means of these hangouts, forums, junior communication, and lots of others. So now they have taken a step ahead. They want to do everything, and once they are graduate, they just directly want to fall into the residency. They're gonna save their 2 years. First of all, let me highlight the advantages of doing that. They're gonna save their 2 years. They are gonna be as fresh as they can be. They can like use the same USMLE knowledge to pass their medical professional exams, because now medical professional exams have also more objective system. In our days, it used to be subjective system. So, but question always arises about final year student who is in the final year. He thinks that the final year subjects are exactly similar to CK step 2, and he has a tendency to do step 2 direct away. It's a natural tendency. Let me be very clear. It's a natural tendency when you're in final year and you just started thinking that you should do step now, you start thinking of step 2. I'm not saying it is wrong. People have done that. We have many good our forum members. Mohammed Masab has done that, and many other. I remember his name. They have good scored, very good as well. But again, tell me, if you go by statistics, they are only 20%, 20 to 30% people. More percentages of those people who just started CK in their final year thinking the same thing, and they get some underscore. Some failed, and some were like scored like 220, 230, 240. So why is that? First question should arise, why is that? The answer to the question is that step exams, they have a language. They have a very particular language. When you go to a country, you have to learn the language of that country. Similarly, when you start reading some books, you really have to know their language. They never ask anything out of their course. They all, whatever they ask whatever they teach you. But there is a way they teach you. They don't teach you everything in your step 1. Even in step 1, they don't teach you everything in Kaplan. You must have read my notes on UWorld. They tell you 80% of a topic, like if they are telling you about some, suppose, let's take an example over there. If they are discussing cardiomyopathy, they will, 80% of that information or knowledge, they will share in Kaplan. But the remaining 20%, they will divide. The 10% they will discuss in first aid or master the board, and the remaining 10% or 15% they will ask in UWorld. So you cannot skip anything. The purpose is that you have to buy all the books because it's all commercial. That's how they have written the books. So you have to do all the books. If they could have mentioned easily all 100% knowledge of a topic in one book, but then their books would not have been sold out. So same is true for step 1, step 2. They, in the step 2, 20% or 15% of the time they ask a step 1 question. Step 2 is nothing but it's a continuation of the step 1, because the main subject in step 2 is medicine. And medicine is what? It's a combination of physiology, pharmacology, pathology, microbiology, genetics, whatever you could imagine. It's all combined as a medicine. If you directly jump to the medicine, you could have, ritualized whatever is there. But basic behind that, you could have missed. And that's the time you don't pick up the question in the MLE exam. People have done that, but those are very extraordinary conditions. And everyone is not extraordinary. So be very clear, go by convention, don't try to be unconventional during this 2-year journey of step exams. Just don't be unconventional. So I would still say, if you are starting in a final year, you have just thought in the start of the final year, go by still step 1 first. And you can do that. There's no rush about that. Use the CK books for your professional exam. Like if you have to read medicine in your final year, don't read the Robinson, don't read the Harrison, all those books. Just read the CK Kaplan. But read it with the point of view that you have to pass your professional exam. But that will also give you some know-how when later you will start your CK. If you want to do in step, ideal time to start thinking of your step exam in MBBS is right away from your first year. I would not say third year. It's right away from your first year. How? Just read your all first year subjects with the Kaplan books. These days you can pass easily your professional exam with the Kaplan books. Read your physiology, anatomy, biochemistry in first year and second year just from the Kaplan. In third year, if you wanted to start thinking about third year, read your third year subjects from the Kaplan, which are mainly general pathology, microbiology. You can read from, if you are in fourth year, read your fourth year subjects from there, and that's again pathology, mainly pathology. Use your vacation period when you get 1 month vacation. Use that period for reviewing those subjects which were in the previous class. Like if you are a fourth year, You are reading pathology, you have a vacation, read physiology and anatomy and biochemistry in the vacation. So you will always be synchronized finally. But thing is that just don't be unconventional. Then next question arises, what should be the best time for elective? So first of all, people should realize the difference between observership, externship, and elective. Many people still asking the question, maybe they don't really read the post which we like. It really takes time when we write the posts, we write the blogs, and we post on the forum, but people don't read it and just ask the question. So before asking a question, just first read it. Very clearly it is written over there, elective is a rotation which you do before you graduate. And what is the definition of graduation? Definition of graduation is when you get your degree. MBBS degree has a date of graduation. Whatever you do before that is your elective. Whatever you do. Whatever you do after that is your observership. Whatever you do after that with a hands-on experience, that is called externship. So externship and observership, first of all, they're always after the graduation. And externship is superior to observership because in that you physically touch the patient, you examine the patient. In observership, you cannot examine the patient, you can just follow your observer. In Karthik, which we are offering, by blessing of Allah, we have externship over there, and people have examined the patients over there, and they get letters of hands-on experience over there. So just see the difference. Now, what is superior and what is not? Of course, elective is the superior, most superior. After that, externship, and third number is observership. Then don't mix the research with the clinical experience. USC means United States Clinical Experience, which includes externship, observership, elective. There is a second category that is called research. Research has further two categories, with publication, without publication. But don't mix that. Research does not come under USC. USC is something different. And research also helps you, especially it fills your gaps. People who have big gaps in their CV, I would suggest them they should have some research, even without a publication, doesn't matter, but at least that widely covers their gaps. So this is about the doing step exam as an undergraduate while you are MBBS. Always get one senior and just tell him that you have to mentor me, you have to coordinate me, you have to जिस तरह होता है कि हाथ पकड़ के लेके चलना. किसी को जब वो आपका हाथ पकड़ के लेके चलेगा, तो जब आप ग्रेजुएट हो जाओ, आप रेजिडेंट बन जाओ, then you pick someone. किसी एक को चुनो, and I'm not saying help dozens of people, at least 2 or 3. If one person takes a responsibility of 2 or 3 people, so that is how it is called, mashal se mashal, you know, it becomes then massive. People who are now residents, I'm very happy to see Usama, Arsalan, Noman. These are all those people who, like, we know them very well. Me and Arsalan were same time in the Carthage, and we used to do externship that time. And Osama and me and Noman was also in Carthage. So we have been in close collaboration. Where you are sitting now, these people used to sit year ago. They used to have the same apprehensions. Oh, मैं मैच होऊंगा कि नहीं होऊंगा, अगर मैं अनमैच रहूंगा तो वो 2% में मैं ही होऊंगा. मतलब we always put ourselves on those unmatched percentages, although they are very low. But now they have crossed that line. So if they have crossed that line, there is no question that why you should not cross that line. Of course, you will also cross that line. So this is how it has been going on. Our seniors, Umar Tariq Bhai, they used to guide us. We used to guide them, and they will guide you. So this thing will keep on going and going like that. So I think from here we have covered many topics. Let's start our answer question session. I will go over to Osama. Osama, can you hear me? Okay. I think Osama is not here.
I have
Numan
some
bhai ke
questions.
paas hai.
Okay, Numan, over to you.
Okay, I have 2 questions. Let's start one by one. The first question was from Shahryar Ranja. So the question is that whether Pathoma textbook plus videos are enough, or should we only go for golden textbook?
Okay, actually I don't know about Pathoma. I can speak only for Golden, but Arsalan, do you know about Pathoma?
Ji, ji.
Okay, you will
So the
answer.
thing is, the point. So he's probably talking about step 1 exam. So probably the thing is actually my personal experience is even the Goljan or Pathoma plus lectures, they are more than enough for the step 1 exam because they are big textbooks. The most important resource for step 1 exam pathology is actually the U-World pathology itself, because around 50% of the questions of U-World, which are total about 48 blocks, but 22 blocks belong to pathology. So that's a huge thing. Comprises about 1,000 questions, about equal to about 1,000 pages book. So I would say the most important thing in Pathoma or Goljan is to clarify your concepts. Either you go for Goljan or either you go for Pathoma, try to clarify the concepts so that you might be able to grasp the first aid pathology later on, and also the U world. So it's your personal discretion. I would say read a chapter from Pathoma and then do the same chapter from Goljan, and then see in the start of the preparation which one is better for you. Different things suit different people. I personally did Goljan for myself because Pathoma was not out at that time. But I personally think that as far as people have told me that Pathoma is a better book combined with the lectures. So my recommendation is for Pathoma, but still if you like Goljan, that's fine by me. And people have scored 270s with Goljan as well, so that's totally fine. Whatever suits you, just try yourself.
Okay, so let me be a little, let me be adding some remarks to this. In our days, there used to be only Goljan. I really don't know about Pathoma. So Goljan, what is Goljan? It's not a, it's a reference book. There are two kinds of books. Always remember, there is a textbook and there is a reference book. Textbook is what you really swallow, like you have to digest, and this is what you take with you in the examination hall. Reference book is always to fill those gaps which are in your textbook. So we always used to read Goljan in our second read and third read. In only two reads we used to read. And well, while doing pathology, like if we have read a subject, one topic, let's say it is diabetic ketoacidosis, first we used to read it from pathology. So pathology Kaplan. Then we used to read the same topic from Goljan. Add-on points. Goljan has add-on points. If you see Goljan, all the pages have small boxes on the right corner. We used to pick those points and we used to chit, like small chits paper. We used to paste them on our Kaplan. It means that extracting points from the Goljan, converging them onto the Kaplan, so that when next read you read Kaplan, you really do not have to open the Goljan. Once you open the Goljan, you have to dive into it. It's a big book. So that's how we used to do. Unfortunately, what I extracted points from Goljan, somehow I lost them. Otherwise, I could have compiled them as my step 2 notes. My step 1 notes somehow they got lost. But yeah, Pathoma, as Arsalan explained, they are same. Third category is Goljan lectures. So Goljan lectures are equal to Goljan book, which is equal to Pathoma. So whatever you feel like, you can pick up. We have here Farhan Ahmed with us, so I would just shift on him because he joined conversation later to just add remarks because on it, and then after that we'll back to the question. Farhan, over to you.
Farhan bhai, it's your turn. You can talk. You can unmute the microphone. Unmute the microphone. Yeah, it's yeah.
Everyone can hear me now.
Yes, we can hear you.
So first, I'll congratulate each and every new intern. मेरा जो guidance है, thing is, I'll guide you in a totally different way. USMLE पे बहुत कुछ हो चुका है, it's a repeat thing. मैं नहीं कहूँगा. मैं अगर कोई मुझसे इस बारे में क्वेश्चन करना चाहता है कि how they will come, how they will adjust, what about their new life here in US, उससे आंसर करूँगा.
Okay. Over to Noman for questions. Let me unmute you. Okay, Noman. Noman, can you hear us?
Yeah, I can hear you. Okay, so the next question is from Farwa. She asks whether, what's the best source for neuroanatomy?
Okay, so Arsalan, you want to answer?
मेरे ख्याल से वकास भाई सब लोग जो है ना ज़्यादा जो स्टेप 1 की जिन्होंने प्रिपरेशन शुरू की है they're mostly asking about the resources, the good resources for different subjects. So I'm going to talk about all the subjects of the step 1 very briefly. So my point is, as Vikas bhai told, some people basically say कि ये जो reads वाला system is not that much important, but the thing is कि इसकी importance इस तरह से है कि first of all as 8 months की preparation है, तो शुरू के जो 4 months है या 5 months है उसमें आपने अपनी base build करनी होती है, आपने अपने concepts को clarify करना होता है. उसके लिए you need a little bit more detailed books, a little bit lectures and things like that, and it is so much important कि by the end of 5 months before starting the U World, if you take an NBME, if it gives you a score about 245, तो उसके बाद 3 months U World करने के बाद भी आप तकरीबन उसी स्टेज के ऊपर बैठे होते हैं. So the point is that the main difference, the preparation of different people is in the starting first 5 months. और उसके लिए आपने कौन से resources यूज़ करने, the best resources जो कि conventionally देखे गए हैं वो ये कि Kaplan की books. Neuroanatomy के लिए surely Kaplan की book is more than enough. I would personally say कि जो बंदा भी step 1 की preparation शुरू करे, they should start with Kaplan in the first read plus the video lectures. It would take about 2.5 months to 3 months. सारे lectures को सुकून से सुने, उनको लिखें, जो भी करना चाहते हैं, books के ऊपर annotate करें, whatever you want to do. Second read के अंदर जैसे विकास भाई ने कहा कि you can add Kaplan Q Bank, you can add U World, you can add First Aid, जो भी आपने resource second read में add करना है, Kaplan के साथ उसको दोबारा revise करें नए सिरे से completely. और second read में आपको lectures दोबारा सुनने की ज़रूरत नहीं है, सारी के प्लान सेकंड रीड में रिवाइज करें, साथ में कोई और रिसोर्स ऐड कर लें, न्यूरो एनाटमी क्या, साइकेट्री क्या, बिहेवियर साइंसेज क्या, एनाटमी, ईच एंड एवरीथिंग. सेकंड रीड के बाद जब आप 5 months आपके एंड हो चुके होंगे, अब आपने थर्ड रीड स्टार्ट करनी है. थर्ड रीड के अंदर द मोस्ट इंपॉर्टेंट रिसोर्स इज एक्चुअली फर्स्ट एड एंड द यू वर्ल्ड. आई वुड सजेस्ट कि थर्ड रीड के अंदर आप टोटली स्विच कर जाएं कैप्लन से फर्स्ट एड और यू वर्ल्ड के ऊपर, क्योंकि करंटली जो है वो देखा यह गया कि जो लोग यू वर्ल्ड को 2 या 3 दफ़ा करते हैं उनका स्कोर ज़्यादा आता है. तो थर्ड रीड के अंदर मैं ये सजेस्ट करूँगा कि जो फर्स्ट एड है दैट इज़ डेफिशिएंट इन फिजियोलॉजी, it is deficient in genetics, it is deficient in some of the neuroanatomy and behavioral sciences. So इन 4 subjects के लिए मैं repeat कर देता हूँ, physiology, neuroanatomy, genetics, behavioral sciences. इनके लिए आपने थर्ड रीड के अंदर भी मीन्स के 1 महीना या 15 दिन बिफोर द एग्जाम आपने अपनी फिजियोलॉजी की अपनी कैप्लन्स को स्पीड के अंदर रिवाइज करना है, साथ में फर्स्ट एड और आपका यू वर्ल्ड या आपके एंड के 2 या 3 मंथ्स का रिसोर्स है. इसको जितना कर सकते हैं, इसके साथ सोएं, इसके साथ जागें, इसके साथ खाना खाएं, जो भी करना है, एंड गिव द एग्जाम, एनबीएमई दें. तो आई थिंक दैट्स अ सिनेरियो जो मेरा ख्याल है कि क्योंकि मसला ये है अगर आप एंड तक कैप्लन अपने साथ रखेंगे तो कैप्लन का इशू ये होता है कि आप माइक्रोबायोलॉजी को 10 दिन में रिवाइज करेंगे, उसके बाद जब एनाटमी पे स्विच करेंगे, एनाटमी खत्म करेंगे तो माइक्रोबायोलॉजी भूल चुकी होगी, एनाटमी याद होगी तो फिजियोलॉजी भूल जाएगी. तो एंड के ऊपर जब बुक्स को छोटा करते जाएं, रिसोर्स को छोटा करते जाएं, कॉन्सेप्ट्स को अच्छा करते जाएं, अपने क्वेश्चंस के ऊपर ग्रिप पैदा करनी शुरू करें, क्वेश्चंस को ज़्यादा सॉल्व करें. स्टेप 1 का भी ये रूल है, स्टेप 2 का भी ये रूल है. स्टेप 2 के अंदर आप अपनी एमटीबी से स्टार्ट लें, कैप्लन से स्टार्ट लें, जो भी है शुरू के 2 मंथ्स बड़ी बुक से पढ़ें, कैप्लन से पढ़ें, एमटीबी से पढ़ें, 2 पढ़ें, 3 पढ़ें, जो भी पढ़नी है. और आखिरी रीड के अंदर टोटली यू वर्ल्ड के ऊपर स्विच कर जाएं और छोटा रिसोर्स आपने जो नोट्स बनाए हुए हैं एमटीबी 2 के ऊपर, एमटीबी 3 के ऊपर, उनके ऊपर स्टिक करें. तो आई थिंक दैट्स द की टू गो फॉर एनी काइंड ऑफ एग्जाम, चाहे स्टेप 1 हो, 2 हो या स्टेप 3 हो. तो दैट्स व्हाट आई थिंक. जी
Salan, there is a question about biostats. A lot of people are confused whether you talked about it's a biostat that is in the U world or whether it's a separate like a biostat question bank by the U world. So which one do you prefer?
मैं उसके बारे में बता देता हूँ. जी मैं उसके बारे में बता देता हूँ. जी बिल्कुल. So the thing is biostat के लिए there are multiple resources. ये वकास भाई ने भी वही पढ़े होंगे. द बेस्ट रिसोर्स जो कि मैंने बायोस्टैट का थ्रू आउट देखा है वो डॉक्टर स्टीवन डॉकर्टी हैं, उनके बायोस्टैट के लेक्चर्स हैं, बिहेवियर साइंसेज के लेक्चर हैं. दे आर एक्सीलेंट. आई थिंक देयर इज नथिंग टॉप ऑफ दैट, क्योंकि बिहेवियर साइंस हम लोगों ने मेडिकल स्कूल में नहीं पढ़ी होती तो हम लोगों को इसका सही तरह आइडिया नहीं होता. आई वुड स्ट्रांगली सजेस्ट कि आप स्टीवन डॉकर्टी के लेक्चर्स 1 दफ़ा सुने, 2 दफ़ा सुने, उनको लिखें, उनके नोट्स बनाएं. मैंने पूरा रजिस्टर बनाया था, 1.5 रजिस्टर बन गया था मेरा सिर्फ बिहेवियरल साइंसेज का. और मुझे एंड के ऊपर ये फील हुआ कि मुझे बुक पढ़ने की जरूरत ही नहीं थी, वो जो रजिस्टर था दैट वाज मोर देन इनफ, क्योंकि डॉक्टर स्टीवन डॉकर्टी ने पूरी बिहेवियरल साइंस जो कैप्लन किया वो बहुत डिटेल में डिस्कस की हुई है. सो आई वुड स्ट्रांगली सजेस्ट कि जो फर्स्ट स्टेप 1 की फर्स्ट 2 रीड्स हैं उसके अंदर आप कैप्लन को स्टिक करें, स्टीवन डॉकर्टी के लेक्चर सुने. थर्ड रीड के अंदर श्योरली आपने यू वर्ल्ड तो करना ही करना है बिहेवियरल साइंसेज का, साथ में आप लोगों ने फर्स्ट एड भी करनी है. लेकिन थर्ड रीड में आई वुड स्ट्रांगली सजेस्ट कि आप पेपर से 15 या 20 दिन पहले 1 या 2 दिन लगा के बिहेवियरल साइंस को एक क्विक रीड कैप्लन से जरूर दें. और अगर अपने डॉक्टर स्टीवन डॉकर्टी के लेक्चर्स रिपीट कर सकते हैं करें. सो मेरा एक्सपीरियंस ये है कि यूएसएमएल स्टेप 1 में जो यू वर्ल्ड है दैट इज लेस फॉर बिहेवियरल साइंसेज एंड बायोस्टैट्स। बायोस्टैट जितनी यू वर्ल्ड में बताई हुई है उससे ज़्यादा पूछी जाती है, उससे डिफिकल्ट पूछी जाती है। इसलिए स्टीवन डॉकर्टी के लेक्चर्स मस्ट हैं। कैप्लन बिहेवियरल साइंसेज की मस्ट है। एक और बुक है फर्स्ट एड या हाई यील्ड बिहेवियरल साइंसेज, कुछ लोग पढ़ते हैं, थोड़ी सी मुश्किल है, इट टेक्स अबाउट 1 वीक। अगर कोई बंदा रीड करना चाहे तो कर सकता है, लेकिन आई वुड स्टिल से कि एटलीस्ट आप अपनी कैप्लन और स्टीवन डॉकर्टी के लेक्चर्स को हैंडी ज़रूर रखें। एक छोटा सा मैं आपको मशवरा और देना चाहूँगा कुछ लोगों को, वो ये है, मेरा अपना पर्सनल एक्सपीरियंस यूएसएमएलई के अंदर ये रहा है कि यूएसएमएलई में अक्सर लोग ये कहते हैं कि एक व्हाट द हेक क्वेश्चंस होते हैं, विच मीन्स कि जो लोगों को फील होता है कि चीज़ पढ़ी हुई नहीं है। स्टेप 1 में बायोस्टैट्स या बिहेवियरल साइंसेज से व्हाट द हेक क्वेश्चंस आते हैं, और मैंने ये फील किया कि जब मैंने स्टेप 2 की प्रिपरेशन शुरू की तो मैंने देखा कि स्टेप 2 का जो यूवर्ल्ड था उसके अंदर बिहेवियरल साइंसेज के वही वाले सवाल डिस्कस हुए हुए थे जो कि मेरे स्टेप 1 के पेपर में आए हुए थे और कैप्लन के अंदर स्टेप 1 की कैप्लन में या लेक्चर्स में नहीं थे। तो मेरी आपको सजेशन ये होगी कि अगर कोई बंदा एक स्टेप आगे जाना चाहता है बिहेवियरल साइंसेज के अंदर, तो वो ये कर सकता है कि अगर उसके किसी सीनियर के पास स्टेप 2 का यूवर्ल्ड है या स्टेप 3 का यूवर्ल्ड है, उसमें हार्डली 50 या 60 सवाल बायोस्टैट्स के बिहेवियरल बायोस्टैट्स के होंगे। आप स्टेप 2 के यूवर्ल्ड के वो 50 सवाल बायोस्टैट्स के निकाल के स्टेप 1 की प्रिपरेशन में ऐड कर लें। आई एम प्रीटी कॉन्फिडेंट कि उसमें से भी 1 या 2 सवाल आपके स्टेप 1 के अंदर आ जाएंगे एंड दैट विल बी हेल्पफुल। ओवर टू नुमान भाई।
Okay, thank you so much, Arsalan. So I have a couple of questions regarding like CS exam. So somebody is asking whether Atlanta is okay for CS exam, and that is it. So any thoughts, guys? Hello, can you guys hear
नुमान भाई
me?
इसके बारे में मैं एक छोटी सी बात कहूँ, वो ये है कि जो पहली बात अंडरस्टैंडिंग वाली है ना, वो ये है कि जितने भी CS के सेंटर्स हैं दे आर ऑल स्टैंडर्डाइज्ड। हर जगह के ऊपर जो SPs हैं दे आर एग्जैक्टली द सेम। केसेस थोड़े थोड़े से डिफरेंट है, लेकिन वो तकरीबन एक ही स्पेक्ट्रम के हैं, एक ही डिफिकल्टी के हैं, और पासिंग फेलिंग रेट तकरीबन एक जितना है। कुछ लोगों ने देखा कि फिली के अंदर लोग ज़्यादा फेल हो जाते हैं, कुछ लोग कहते हैं कि अटलांटा में लोग फेल होते हैं, कुछ कहते हैं ह्यूस्टन में। मेरी अपनी पर्सनल अंडरस्टैंडिंग ये है कि शिकागो का पासिंग रेट इसलिए ज़्यादा है क्योंकि मैक्सिमली जो अपना हाउसेज है वो डिट्रॉइट में है, लोग वहाँ पर बैठ के तैयारी करते हैं तो उनको मेंटरशिप मिलती है। आई थिंक द मोस्ट इंपॉर्टेंट थिंग इज़ कि आपके साथ बहुत स्ट्रॉन्ग आपका एक पार्टनर होना चाहिए प्रिपरेशन के अंदर, जो आपसे ज़्यादा अच्छा हो, ताकि आप उसके पीछे लग लग के बेहतर तैयारी करें। और आपके पास कुछ सीनियर्स होने चाहिए जिन्होंने रिसेंटली पेपर पास किया, जो कि आपका केस सुन के आपको बता सकें कि क्या आप अभी पेपर देने को तैयार हैं कि नहीं है। तो इसमें सेकंड थर्ड चीज़ ये है कि जो डिट्रॉइट है वहाँ पर चक्कर सिर्फ ये है कि शिकागो के मुताबिक तैयारी के लिए जो नोट्स हैं वहाँ पर अवेलेबल हैं, माजिद भाई की गाइडेंस अवेलेबल होती है, तो इसलिए शिकागो का पासिंग रेट ज़्यादा है। मैं ये समझता हूँ कि डिट्रॉइट का अपना ह्यूस्टन में शिफ्ट हो जाए, अटलांटा या फिलाडेल्फिया शिफ्ट होता है, तो इन सेंटर्स का भी पासिंग रेट उतना ही हो जाएगा जितना शिकागो का है। तो पेपर टोटली स्टैंडर्डाइज्ड है, लेकिन इफ़ यू वांट टू गेट द बेस्ट शॉट आई वुड स्टिल एडवाइज गो टू द डिट्रॉइट अपना हाउस, स्टे ओवर देयर, प्रिपेयर ओवर देयर। वहाँ पर बहुत ज़्यादा गाइडेंस अवेलेबल होती है, एंड टेक द पेपर इन शिकागो बिकॉज देन यू वुड हैव द मैक्सिमल चांस टू पास द एग्जाम। फ़र्क सिर्फ इतना है कि अगर फिली का ओवरऑल इंटरनेशनल पासिंग रेट जो है वो 60 या 70% है, शिकागो को मैंने ऑब्जर्व किया कि 90% के करीब है। इसकी कोई और रीज़न नहीं है, इसकी सिर्फ ये रीज़न है कि वहाँ पर गाइडेंस ज़्यादा अवेलेबल है, माजिद भाई खुद होते हैं और सीनियर्स जो हैं वो गाइड करते हैं। तो अटलांटा इज टोटली फाइन, उतना ही पासिंग रेट होगा जितना फिली का होगा, उतना ही पासिंग रेट होगा जितना ह्यूस्टन का होगा। शिकागो का थोड़ा सा इसलिए ज़्यादा उनके ऊपर गाइडेंस ज़्यादा अवेलेबल है।
Nepal, there is some problem with accommodation in Detroit, at the Apna House Detroit, in Michigan. So a lot of people were worried as to where they can go and actually study for the step to CS exam. So in my personal opinion, if you want to like study hard, just select a partner and just keep on practicing cases. And during your preparation, always keep on like showing cases to the senior, as Arslan has mentioned. So they will definitely help with your problems and with your communication, with your interpersonal skills, and also try to make a short video of your case presentation. Ask your brother or sister to hold a camera or your phone and just record yourself interacting with an SP. So in that way you can like judge yourself and see where you stand, your personality issues, your some issues with your voice, or your issues with your eye contact. So that will be helpful as well. So let's just move on to the next question, and let's see. So this guy is asking whether only first aid is enough for step 1, and should we go in detail in the Kaplan? So Arsalan or anybody else would like to answer that question?
जिसके बारे में जो मेरी अपनी पर्सनल ओपिनियन है वो ये है, पहली चीज़ ये है कि एक्सेप्शंस आर एवरीवेयर। अगर कोई बंदा, मैंने ऐसे लोग भी देखे हैं जो कहते हैं हमने स्टेप 1 की, दे ओनली प्रिपेयर फॉर 1 मंथ एंड दे टुक लाइक 260s। सो शुड वी फॉलो दोज पीपल? डेफिनेटली नो। we should go by the convention। जिस तरह से वकास भाई ने बताया कि there is a preparation about 8 months, मैंने I personally prepared for step 1 for 7.5 months, और मेरा अपना पर्सनल ख्याल है कि I couldn't have done before that। लेकिन the thing is कि I do not know, ये उमर है मेरे ख्याल से जिसने क्वेश्चन पूछा है, I do not know कि आपका एजुकेशनल स्टेटस क्या है। अगर एक बंदा ऐसा हो जिसके गोल्ड मेडल्स थे, who has excellent concepts, जिसने MBBS के दौरान फर्स्ट ईयर सेकंड, he's in final year, जिसने फर्स्ट ईयर सेकंड ईयर थर्ड ईयर के अंदर फिजियोलॉजी गाइडेंस से पढ़ी, जिसके कॉन्सेप्ट्स बहुत क्लियर है, अभी उसको